The PAEA just released an official statement a couple weeks ago saying that they support the master's degree as the terminal and entry level degree for the PA profession. So, what does that mean? Well, basically, PAEA is saying that the master's degree is it for PAs. That's what they support as the minimal and maximal degree, that they don't think that we need any changes, that they're not endorsing a doctorate degree for PAs. I have definite opinions about this, and I'll get into that and I'll tell you what I'm seeing other people saying on the forums and kind of just talk about the whole doctorate for PAs. But first, before we dive into all that, I want to talk a little bit about who the PAEA is. Because if you're like me, I didn't really have any idea about this organization, hadn't even heard about them until like this past year. Not really sure what they do. So I looked them up, I did a little bit of reading. Basically, the PAEA started in 1972, and it was originally called the Association of Physician Assistant Programs, then changed its name to PAEA, which stands for PA Education Association. The PAEA defines the specific knowledge, skills, and attitudes that PAs in all clinical specialties and settings in the United States should be able to demonstrate. Now, why it's important that PAEA came out with this stance and why it affects the profession is because ARC-PA, the group that oversees the accreditation of PA programs, they don't have any authority to be able to approve a doctorate, an entry-level doctorate degree for a PA program. Like, say a PA program decides that they want to offer an entry-level doctorate degree, they can't just do that and have ARC-PA approve it. ARC-PA can't approve or do anything until PAEA and other PA groups align their vision for and their thoughts for what degrees PAs should get. So there was a lot of fighting and different opinions about the PA name, physician assistant versus physician associate. And there's still a lot of debate and fighting about OTP. But this has to be, I think, the third thing that people are fighting about within the profession and have differences of opinions on about whether PAs should get doctorates. If you would have asked me this when I went to PA school, when I started in 2013, I wouldn't want this to be a doctorate program, because if I was going to get a doctorate, I'd just go to med school, right? Because in my mind, I was thinking I'd go to 4 years of undergrad, and then to get a doctorate, I'd go to 4 years of PA school. So why would I want to do all that to not come out and be an MD? And I still see that argument today. I've seen some people recently on some different posts saying, well, I don't want a doctorate because I'll be just like going to med school. But what I didn't realize, and what I think most people don't realize, is that that's not the case. So let's look at PA education as it is right now. If you look at the numbers of how many credits we take in order to get our master's degree, it is above the number of credits required from other professions like nurse practitioner and physical therapists and so on to get their doctorate degree. So, as our master's program, as it is right now, we are already getting enough credits to qualify as a doctorate degree. But we can't just go and say, oh, we're not changing anything and now we're going to call this a doctorate degree. Of course, that's not going to fly. But it really wouldn't take much more to change our programs from master's to doctorate. And that was something I didn't realize before. So, what I'm hearing and seeing and reading is that basically there would be a few more stipulations, like we would need to add some non-clinical things like education and health law, research, advocacy, those kind of things. But that really could be achieved in like 3 months' time. And also, what I'm seeing on the forums, people who have started PAs who have started PA programs say that they've done the math and it really wouldn't add very much money at all going from a master's to a doctorate. So people who say, oh, well, going to a doctorate, you're going to then further discourage people coming from underprivileged backgrounds becoming a PA. But Not really. Actually, if we can change these programs a little bit to meet those requirements, then it really wouldn't make a big difference in cost or time. And it's certainly less expensive than getting your master's and then being forced to have to go back later and get your doctorate. The other reason that I think a lot of people are kind of up in arms about this decision and think it's absolutely the wrong decision is that it kind of feels like, still, as a profession, we're just kind of putting our head in the sand and have this Pollyanna attitude that if we do our jobs and do it well, everything's going to be just fine. Well, I think a lot of people are starting to realize that is not the case. And I'm not trying to be an alarmist and say that the PA profession is just going to disappear overnight. I mean, that's not logical and that's not likely, not going to happen. But it is pretty clear, especially to people in certain states, that we are not remaining competitive. Nurse practitioners are getting doctorate degrees by the truckloads. The numbers are exponentially growing of DNPs. And also, nurse practitioners have independent practice in more than half of the states in the United States. So you have somebody in administration looking to hire a clinician. This person probably has never practiced medicine themselves, and they're looking at two resumes. And they've got one clinician who's got a master's degree and they require a supervising physician. And then you've got this other application over here, and it says that they have a doctorate degree and they can practice without having to have charts signed off or some other physician taking responsibility for them. So, which one are they going to choose? I think we all know that they're going to choose the nurse practitioner. And this is happening already. You can see all kinds of posts on social media. You can talk to all kinds of people, PAs, who live in states where nurse practitioners have independent practice and realize that we're kind of being left in the dust. You will see postings all the time that say nurse practitioner only, or if they don't say only and they just say nurse practitioner, but you apply and then you talk to the hiring manager and they're like, oh no, we're not looking for PAs. We're only hiring for nurse practitioners. And some people may not be aware that this is happening, but trust me, it's happening all across the United States. And it's happening enough that PAs are having difficulties in some places finding jobs. Now, do we think that that is just going to disappear one day? It's magically going to take care of itself if we keep our head down and do our work and soldier on with our master's degrees? It's not likely. So, if we're being realistic, if PAs really stop and look at what is happening in our profession and outside of their little bubble that they're working in, they'll realize that we're kind of in trouble. We're at a big crossroads. And I think that the things that need to happen is that we need to get OTP and we need to have a doctorate degree. And trust me, I wish I didn't have to say this. I wish it wasn't the case. I signed up to get a master's degree. I signed up to have a supervising physician. And, for the most part, I'm fine with that. But when it comes to reality, when you start working, you realize that most of the time, a supervising physician is just more paperwork and red tape and things that hinder you from being able to do your job, and that you're going to get help when you need it from the colleagues around you, whether you have that piece of paper or not. And then when you realize that PAs are having a hard time getting jobs in administration and that it's hard to convince politicians to give somebody with a master's degree independence or OTP or whatever you want to call it, it's much easier for them to be convinced that that's the right way to go if you've got clinicians that have doctorate degrees. That's just human nature, and that's just the reality. They have so many other things they're worried about. They're not going to have the time to deep dive into our education. They're just going to look and see what our degree is and say, well, that doesn't seem right. You're a physician assistant and you've got a master's and you want to not be supervised by a physician. So hopefully you can see how that looks to their eyes and why it is holding us back. Now, there's definitely some things that have to be considered. First of all, a lot of these programs that train PAs are not set up or not in a position where they're going to be able to transition to a doctorate. And sometimes that's because the university that they're in doesn't have any other doctorate programs. So it's really kind of foreign territory for them. And then I was kind of surprised to learn that there's about 40 programs in the United States, PA programs, that are a bachelor's through master's program. So there's a combined program. And of course, those programs would either have to go away or drastically change their setup. And then on top of that, you have to have doctorate trained faculty to graduate doctorate students, right? And so that's been a concern. Are there going to be enough faculty that have doctorates, to work in these programs? So these are all realistic things that need to be addressed, but they're not reasons to not move towards the doctorate degree. In my mind, I don't know why PAEA couldn't have said some statement along the lines of, we recognize that it is inevitable that the profession is moving to a doctorate degree. And so we are setting our sights on that, and then put a time limit on it of maybe like 10 years. In 10 years' time, programs will need to be graduating doctorate level PAs as the entry level and only degree for PAs. That will give programs time to adjust and time for faculty and people to get their doctorate degrees. So I know that this is a complicated topic, and there is probably a lot more to it that I don't understand and know. But I have to say that I think that people who are fighting against PAs getting a doctorate need to really think about these things that are facing the profession and be realistic. If you think that us staying at a master's degree is going to keep us competitive with nurse practitioners. The other part of all of this is advocacy. Like I said, it's difficult for politicians to really know who we are and what we bring to the table. So, unfortunately, in the way of American politics, that has to be done through political action committees or PACs. And if you don't know what those are or how they work, then watch this video here where I interview a PA who has been highly involved with PACs and explains how the process works and why we need them to move our profession forward. So that's it for today. Thank you so much for watching. Don't forget to share this video with colleagues who may find it interesting. Take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.